Thank you very much to all our listeners and viewers at home. We are here on behalf of Cabinet and the National Coronavirus Command Council to appraise the whole of South Africa what are the regulations that will apply under Alert Level 3. As we all know, these regulations comes after the President addressed the nation on Sunday with regard to all of us and the entire country proceeding from level 4 to level 3 come the 1st of June, Monday, this coming Monday. Having said that, I will now request Minister Nkosazana Dlamini Zuma, the Minister of COGTA, to come and speak to all of us on the regulations. Minister Dlamini Zuma.
Colleagues, members of the media, and compatriots, 84 days have lapsed since the first reported case of COVID-19 on our shores. From that day onwards, led by the steady hand of the President, we have put in place measures to contain the spread of the virus and save lives and try and flatten the curve. These measures have been coordinated by Cabinet with the advice and inputs of various command centers from the 3 spheres of government. All these levels and spheres have greatly benefited from the inputs of various experts and scientists, including those that serve in the Minister of Health Advisory Committee on the coronavirus. Our efforts have been directed by consultations we've had with various sectors and constituencies in our country, including local government, provinces, traditional leaders, religious leaders, NEDLEC, private sector, and many others. We've also benefited from the overwhelming support we've received from all South Africans. Ordinary South Africans from all walks of life, political persuasions, religious convictions, and cultural backgrounds from all races and classes have largely heeded the call to stay at home, practice hygiene measures such as washing of hands, maintaining social distance, and wearing of masks. These simple but effective measures are the most important ammunition in our fight against COVID-19 in the absence of a cure or vaccine. We have also been encouraged by the recognition of solidarity and activism by millions of South Africans who, through acts of kindness, have ensured that those who are less fortunate have food, they are cared for, and have access to masks and sanitizers. Indeed, we have confirmed ourselves as a great and resilient nation, enobuntu. The measures of a great nation is how it treats the weakest and not the strongest, as once said by Madiba. Thanks to our sacrifice and contribution, we've managed to flatten the curve. But unfortunately, our figures are still rising and the peak is still in the horizon. As we migrate the country into Alert Level 3, as announced by the President, with some hotspots, we must redouble our efforts so as to further contain and prevent deaths. These next phases of our fight and level 3 allows us to open all the productive sectors of our economy, albeit to a moderate degree in some high-risk sectors. This risk level, thanks to the employ of the risk-adjusted strategy, allows us to maintain the delicate balancing act between, on one hand, saving lives, on the other, the livelihoods of South Africans. It also requires greater responsibility and discipline from all of us as citizens of our resilient nation. All of us individually and severally have the responsibility not only to protect ourselves, but to protect the next person. Consequently, at this alert level, everyone who enters a workplace, public space, and/or public transport must wear a mask, preferably a cloth mask or even a homemade item that covers the nose and mouth. We must also ensure that at all our public facilities, there are sanitizers and that all the patrons are screened. This coming phase also confirms prevention as a cornerstone of our response. It is only healthy communities and individuals that can drive our recovery plan on the other side of the infection curve. We must also remain cognizant of the ever-present danger of reversing the gains we have thus far recorded. In fact, the risk of a massive increase in the infections is now greater than it has been since the alert of the start of the outbreak in our country, to quote the President. Compatriots, as we have said before, our risk-adjusted strategy is also based on a combination of sound scientific advice and benchmarking against international experience. These experiences and the WHO confirm the effectiveness of the measures such as the lockdown. However, given our socio-economic conditions, we've had to ease restrictions. Thus, in the employ of the risk-adjusted strategy, we've subjected each province and district or metro to its own level of the risk alert system. This will assist us in mounting coordinated and targeted interventions, especially in the deployment of our limited resources. Nonetheless, as per the announcement of the President, we will move the whole country of South Africa to risk level 3, which implies certain adjustments to our level 4 regulations. However, our state of national lockdown continues until such time that we have flattened the curve for a sustainable period. In this regard, our differentiated approach and risk levels will be directed by the advice we will receive from the Minister of Health and inputs from WHO, ministerial advisory experts, and various cabinet ministers. These levels are applicable at a provincial level, all metropolitan areas, and district within that province, unless a differentiated alert level is explicitly determined as a hotspot. And compatriots will remember that the President did mention the areas that are deemed as hotspots. So as we usher level 3, which will apply nationally from the 1st of June, this year, the following areas are declared as hotspots: Tshwane, Johannesburg, Ekurhuleni, eThekwini, Nelson Mandela, Buffalo City, Cape Town, West Coast Overberg, Cape Winelands District, Chris Hani District in the Eastern Cape, Ilembe District in KwaZulu-Natal. And what that means is that the Minister of Health may advise more stringent measures in some parts in those areas, depending on the spread of the virus. So far, we've only identified potential spots, and we are doing all we can to change the fortunes of those areas. In the event that our collective efforts bear little or no fruit, such an area will require added efforts, including subjecting it to higher level restrictions, including the limitation of movements within and to and fro hotspots. In the areas that are not hotspots, we will allow movement within the district and localities, permit movement to work, to buy, obtain goods and services, for medical attention, for exercise. The limitation on movements across provinces and now between metropolitans and districts and hotspots may be prohibited, except for persons traveling for the purpose of starting work, moving to a new residence, or caring for an immediate family member, and also attending funerals as it has been before, or going for work or business that is allowed under level 3. Given that schools will open in a phased approach, there will also be open travel between provinces and districts for pupils, students, and teachers. As we know, some of them live at the border of provinces and they have to commute pretty much every day. As said by the President, we will lift the curfew and allow more time for exercise, walking, and cycling. However, this is permitted as long as this is not done in organized groups. In this regard, health protocols and social distancing must be strictly observed, including wearing of masks. Public training, fitness, and recreational facilities remain closed, except those conducting non-contact sport matches without spectators. The Minister of Arts and Culture and Sports will elaborate on this. Workplace gatherings for work purposes will be permitted under strict conditions and in the observation of health, hygiene, and social distancing protocols. Employers must ensure that the 1.5 meter distance is maintained amongst employees. We will have to limit the number of people in the workplace so that we minimize the chances of infection, or take other measures to ensure that social distancing is observed. In minimizing the chances of infection on the consumption places for food, entertainment, and recreation will remain closed. These will include places such as restaurants, ship-ins, taverns, nightclubs, bars, cinemas, theaters, fairs, bazaars, casinos, or similar places. But as you know, food will be available from restaurants, from takeaway places, only for collection or delivery, but not for sit down. As will hotels, lodges, and basically all accommodation facilities will remain closed except for confined tourists who may have been locked down and are still in those places, or for quarantine and isolation. But also, since we have opened the economy for people who are traveling for business and work. And the Minister of Tourism will elaborate. With regards to funerals, at level 3, we'll continue to limit the interprovincial travel for the purpose of attending funerals. Those permitted to travel will be legal spouses, partners of the deceased, children and grandchildren of the deceased, whether they are biological, adopted, stepchildren, or foster children. Children, parents of the deceased, whether biological, adopted, step-parents, and foster parents, siblings, whether biological, adopted, or step-brothers and sisters, and of course, grandparents. Indeed, the virus has challenged our ways as a society and our various cultures. This is a time when we should all join in meditation, in fellowship and prayer. Consequently, as the President said, we will have a National Day of Prayer, which will be on Sunday, but this will be praying at home or virtual, through virtual means. We have also widely consulted with religious sectors led by our President and are now in a position to categorize religious counseling as an essential service. This will enable the millions who have been affected by this virus to receive this such needed service, since the majority cannot afford professional attention on this, of this nature. Religious gatherings such as in places of worship will be allowed from the 1st of June, so long as health, hygiene, and social distancing is observed. This means that we must maintain 1.5 meters between the worshippers and the maximum of 20 congregants. Should the chosen venue be able to accommodate such? If indeed the venue is too small to accommodate 50 people at 1.5 meters apart, it means there'll be less congregants in that venue. They must also be wearing masks and sanitizing of hands and no contact. And they must also be screening when people arrive at the place, so that those who may be having symptoms may be sent for testing or medical attention. Our lived experience have shown that funerals are COVID-19 transmission vessels. Consequently, we will continue to limit the number of funeral attendees to 50, provided the transportation, hygiene, health, and social distancing protocols and guidelines are observed. The station commanders of all police stations or a person charged by them will keep meticulous records with regard to the funerals and number of people attending. Recent experience, particularly in the Western Cape and Eastern Cape and Limpopo, show that interprovincial travel has contributed to community transmission. Consequently, travel between the provinces is not permitted with the exception of those possessing a permit to attend a funeral or conduct essential services between our provinces and districts, or are going there for work or business. And they will have permits, workers, and those who are going there for business will have permits from their employers. The big challenge about interprovincial travel is really the fact that the economic hubs, which have the majority of the people, are also, on the whole, the ones that have more infections. And so it's important that when people come to these places for work, they don't then commute every weekend to go to another province because they may be transmitting or taking the virus. As we know, the virus doesn't move, it's moved by people. So that is the reason why we have to still limit interprovincial travel. Our international ports of entry remain closed except for those designated by the Minister of Home Affairs to undertake the transportation of fuel and cargo for humanitarian operations, repatriation, or evacuations of for medical emergencies, movements for international organizations that may be deemed important, but also South Africans still coming back home and foreigners leaving the country. And also those who may be coming back to study as the schools open, or coming back to work who work in South Africa but live in other neighboring countries. So the Minister of Home Affairs will indeed give directions in that area. In order to ensure smooth movement of employees and as a measure of careful and gradual opening of our economy, we will also permit domestic air travel at a date that will be determined by the Minister of Transport. And of course, interprovincial cargo for carrying imports, exports, and goods manufactured in South Africa will continue. And the Minister of Transport will make announcements, but the health protocols still have to be kept. And amongst those returning to work are all public servants, with the exception of those who have permission to conduct work from home. And of course, as we announced right from level 5, that those who are 60 and above, and those who have other illnesses, who have comorbidities, are encouraged to stay at home and only go out if it's absolutely necessary. And preferably, if they have to work at home, because the mortality rate in those groups is much higher than in the lower groups. This provision also means that local government can and will operate close to full operation. Consequently, council meetings can take place, but under strict health protocols and social distancing, and directions will be issued in this regard. Given the potential to further transmissions, we will continue to ask public engagements, such as these INBIZOs, IDP consultations, to continue to be done virtually or by electronic or broadcast platforms, as we are currently doing. The various associations and businesses have also developed industry-specific guidelines. However, recent experience, particularly in some of the areas that were open earlier, like mining, direct us to strengthen these in consultation with various industries. So what it means is that every company must have a COVID plan and a COVID compliance officer. And that plan must be known not only by the employer, but the employees. And that plan should be available when inspectors come or anyone comes to see, and must be adhered to. And it's important because if those plans are not adhered to and COVID starts spreading in the company will have to close. So it's for the protection both of the company and of the jobs that company offers. Compatriots, when we embarked on this journey, we did say it would not be smooth sailing. We will have to adjust our plans as we gain and gather more experience. COVID-19 has hit hard on all South Africans, particularly those who are vulnerable and homeless. We have mounted a response, but we cannot afford to have many more in the streets. To this end, we will continue to make sure that those who are homeless under level 3 are still kept in shelters. However, given the rental income is also an important livelihood stream for some, we have inserted the possibility of a competent court to grant an eviction order, provided it is just and equitable. The sale of tobacco products, e-cigarettes, and related products remain prohibited for this period, except when they are destined for the export market. The sale of liquor in licensed premises will now be permitted as of the 1st of June for the limited period between Monday and Thursday from 9 a.m. to 1700 hours. However, on-site consumption is prohibited, and e-commerce sales will be permitted subject to the same on-site trade days and times. The Minister of Trade, Industry and Competition will elaborate in this regard. Suffice to say, no special or event liquor licenses will be issued for the duration of this period. In opening the economy, we must maintain a firm eye on our goal of flattening the curve, minimizing the rates of infection and deaths. We must remain conscious of the ever-present danger that we can quickly reverse our gains if we act too hastily or irresponsibly. To this end, the operating sectors of our economy must pay attention to strict health, hygiene, and social distancing measures, as I've said. We must also secure the livelihoods of our citizens. The social and economic measures we have implemented have at times not fully reached the intended recipients. Through collaboration and concerted actions, we will better target our interventions so that we see a brighter and a better South Africa beyond the virus. All the measures we have implemented are difficult but necessary. We must endure today so that we can secure the future of this beautiful country. Indeed, everything that government has done and is doing is to make sure that the virus will not have a very devastating effect on our country, and that post-COVID, people will be there to rebuild their lives and to rebuild South Africa. I thank you. Angithi nje qaphu ngesiZulu ukuthi silana nje namhlanje mangabe siyakhumbula sekuyinsuku ezamashumi ayisishiyagalombili ney'nsuku eziyisikhombisa kwaqala ukuthi kufike lesifo la eMzansi. Uhulumeni eholwa umongameli wathatha inyathelo sonke esizaziyo ukuthi sizame ukunciphisa abantu abazoba nalesifo nabantu abazobulawa ileli gciwane ukuze singazitholi sesisesimweni lapho abantu abaningi sebengenwe ilolu bhubhane bengasakwazi ukuthola usizo ezibhedlela, ngoba mabe babaningi kakhulu abantu abagulayo babe ngaphezulu kwezibhedlela singaba senkingeni. Sibonile kwamanye amazwe ukuthi bekwenzekani, abantu beshona iy'nkulungwane ngey'nkulungwane ngelanga. Siyabonga ke kakhulu ukuthi abantu baseMzansi bakhombisile ukuthi bayawuzwa umyalezo ukuthi kufuneka bahlale emakhaya, baphume kuphela ngoba beyokwenza lokho okufanele bakwenze. Sasho ke ukuthi sesiphuma kulokuthi sihlale emakhaya, asizuvele siphume nje. Kuzofanele siphume kancane kancane ukuze senze ukuthi lesifo singabhebhetheki. Esaqala ke sisezingeni lesihlanu, manje sisezingeni lesine. Ngomhla ka-1 kuJuni sizoya ezingeni lesithathu. Lokuya kwethu ezingeni lesithathu akusho ukuthi sesiphelile lesifo. Empeleni, ngokusho kwenhlangano yezempilo yomhlaba i-WHO, bekufanele ngabe sehlisa uma ngabe nebalo sabantu abangenwa ilesifo sesehla, hayi sisakhuphuka. Kodwa la eMzansi siyaxekisa kancane kancane noma ibalo zisakhuphuka ngoba isimo sethu sinzima, isimo somnotho nesimo sempilo. Ngakho ke kwafanele ukuthi sizame ukuthi enganxanye sibheke ukuthi khusele impilo zabantu, kodwa kwelinye icala sibheke ukuthi abantu bazophila kanjani. Yiko ke kuthiwe umnotho awuvulwe kodwa kancane kancane. Imboni ke zizovulwa, indawo ezithengisayo ziyavulwa, indawo zezimbiwa ziyavulwa, indawo eziningi zokusebenza uzakwethu uzokhuluma ngazo ziyavulwa. Kodwa ekuvuleni kwazo kusho ukuthi kuzofanele ukuthi embonini kube khona indlela yokuthi kuliwa kanjani nalesifo khona embonini. Abantu mabefika kufanele babhekwe ukuthi abanazo yini impawu zalesifo. Mabenazo bangangeni emsebenzini baye kadokotela noma bayothesta. Kwesibili kufanele emsebenzini kwaziwe ukuthi abantu abasondelani bayaqaqana icanti nengxenye 1.5 meters. Izandla ziyagezwa, abantu bafaka izinto zokuvikela ifonyo nezinye izinto, ngoba uma izimboni zingalilandeli lolu hlelo ziyobona sezivalwa, ngoba phela isifo masibhebhetheka ekhona embonini kuzofanele ukuthi imboni ivalwe. Kodwa ke kukhona indawo ezibizwa ngokuthi ama-hotspot, kusho ukuthi indawo la lesifo sibhebhetheka khona kakhulu. Zona ke sizolulekwa ungqongqoshe wezempilo ukuthi iziphi ezinye izinto, imiphi eminye imiqathango ezofakwa khona ukuthi kuvinjwe lesifo. Izwe lonke lizongena esigabeni sesithathu, kodwa kulezo ndawo khona kuzoba khona ezinye izinto ungqongqoshe we-health wezempilo azositshela ukuthi khona kufanele zithi ukuqiniswa. Lezo ndawo ke lezo ndawo umongameli azimemezela. Mayilana ke nokuthi abantu bahamba kanjani. Abantu sebevumelekile ukuthi bahambe basuke kwenye district baye kwenye, bahambe provinsini ngaphandle uma kuyindawo leyo ye-hotspot la kuzofakwa khona, la kungenzeka kufakwe ezinye izinto ngaphezulu kwalezi ezikule level yesithathu. Abantu kusafanele ukuthi bazi ukuthi kusafanele bahlale ekhaya ngoba lesifo amanani asakhuphuka. Fanele bahlale ekhaya, umuntu aphume ngoba azi ukuthi uyapi, uye emsebenzini, uye ezitolo, uyokwenza kufanele akwenze, uya kadokotela noma mhlambe uya exercise ngalezo sikhathi. Kodwa isikhathi esiningi ikakhulu laba abaneminyaka eyama-60 kuya phezulu nalaba banezifo ezinye, ngoba uma unezifo noma unesifo esinye usuthola i-COVID ivama ukuthi yenze umonakalo. Abantu abaningi abashiyayo emhlabeni basuke bethole lesifo beneminyaka engaphezulu kwama-60 noma benezinye izifo. Okunye ke imingcwabo isavunyelwe abantu abama-50 njengoba bekunjalo, akashintshi lutho ngemingcwabo. Uma usuka kwenye iprovince uya kwenye kusafanele ukuthi wenze lokho bekwenziwa uthole imvume njengoba kade kwenzeka. Okunye ke osekuvunyelwe ukuthi sekuvunyelwe ukuthi uma uhamba ngomsebenzi noma ngebhizinisi ukwazi ukuya kwenye iprovince, kodwa kufanele ube nemvume ephuma kumqashi ekhombisayo ukuthi uhamba ngomsebenzi noma uhamba ngebhizinisi. Ezokuthutha kusenjalo kufanele ukuthi mawuya kwezokuthutha ugqoke isifonyo. Noma uphuma nje endlini yakho kufanele ufake isifonyo. Emlonyeni nekhala bawuphuma nje. Ungqongqoshe ke wezokuthutha uzobalula kabanzi. Kuzovulwa futhi nezemidlalo ezithize ezingathintani la abantu bengathintani mabedlala lo mdlalo. Ungqongqoshe wezemidlalo nezamasiko naye uzobalula kakhulu ngalokho. Enye into esivulwa ebingavuliwe kuqala ukuthi abantu abafisa ukuya eindaweni zokukhonza noma ngaba amasonto noma ngaba ama-mosque noma ngabe ama-synagogue noma ngabe yini indawo yokukhonza sebevunyelwe ukuya. Kodwa kunemithetho ekufanele ilandelwe kakhulu ngoba siyazi ukuthi indawo zamasonto zezinye indawo lapho lesifo sibhebhetheka kalula. Kuzoba khona ke imithetho ebalekile kufanele igcinwe. Oqala ukuthi abantu mabefika lapho kufanele babheke ukuthi abanazo yini impawu zalesifo. Uma umuntu enezimpawu zalesifo aye kudokotela noma ayotesta. Kuzofanele bageze izandla mabefika esontweni. Kuzofuneka ukuthi baqaqane 1.5 meters njengoba kushiwo. Bangathintani, kungabi khona isikhathi la kuthintana khona. Izinto ezenziwayo esontweni ezenza ukuthi kuthintwane kufanele zingenzeki. Akufuneki ukuthi kube khona abantu abangaphezulu kwaba50 esontweni. Uma leyo ndawo ikuvumela ukuthi abantu bangaba 50 baqaqane. Uma kuyindawo encane engabavumeli ukuthi baba 50 baqaqane, kusho ukuthi kufanele babe ngaphansi. Okunye osekuvunyelwe obekungavunyelwe utshwala. Kodwa utshwala kuthiwa buthenge uhambe nabo uyemzini wakho. Awuvunyelwe ukuthenga uphuzele lapho. Zonke indawo ezithengisa utshwala zizovumela ukuthi zibuthengise. Nalezo ndawo ezibuthengisayo ngesinye isikhathi kuhlalwe phansi akuzuvunyelwa manje ukuthi kuhlalwe phansi. Noma ngabe usethaveni noma ngabe useshibhini kufuneka ubuthenge uphume nabo busavaliwe. Uhambe nabo uye ekhaya uyophuzela khona. Ikhathi kuzoba umsombuluko kuze kube uLwesine. NgoLwesihlanu ngomgqibelo ngesonto utshwala buthengiswa. Ngesikhathi kuzoqala ihola lesishiyagalolunye 9 ekseni kuze kube ihora lesihlanu ntambama. Emva kwalokho abusathengiswa. Ngoba phela siyazi ukuthi bebuvaliwe ngesizathu. Naleso sizathu asikapheli. So yiko kuthiwa noma buvulwa kodwa abuvulwe ngendlela ehlelekile kancane kancane kungabi nje walala noma uthela wayeka. Ugwayi njengoba siyazi ukuthi isifo esiphatha kakhulu ugwayi nalesifo kuhlasela amaphaphu nezinye izitho zomzimba wona ke usavaliwe. Izikole siyazi ukuthi zizovulwa. Ungqongqoshe wezikole ushilo ukuthi zizovulwa kodwa nazo akuzovele kuvulwe nje ngelanga elilodwa wonke umuntu kuzoya kancane kancane. Siyacela ke kakhulu njengoba kade nenzile nilalela niusekela uhulumeni ezintweni obuzisho. Siyacela futhi kakhulu ukuthi niphinde nisekele. Kulezi ngalesithathu sekufanele ngempela thina umuntu nomuntu athathe inyathelo zokuzivikela nezokuvikela abanye abantu. Njengoba kuvulwa imisebenzi siyazi ukuthi inamba kuzokwenzeka zikhuphuke. Kodwa uma thina sithatha amandla siwafaka kuthina ukuthi mina ngeke ngiphume endlini ngingayifakile imask, mina ngizogeza izandla njalo, mina ngizokwenza ukuthi singasondelani. Ugcine yonke imithetho yempilo kuzosisiza sonke. Siyanicela-ke bantu bakithi ukuthi njengoba kade nenza nakade bengenzi baqale benze, ngoba manje njengoba sekuvuliwe ingozi, njengoba umongameli eshilo ukuthi njengoba kuvulwa ingozi inkulu yokuthi sibonini amanani esekhuphuka kakhulu esenza ukuthi ezempilo zethu zibe ingxaki. Esesifosa futhi mhlawumbe ukuthi sibuyele emuva, kanti asithanda ukubuyela emuva. Kodwa kufanele ukuthi wonke umuntu azi ukuthi kufanele abe nediscipline, enze lokho okufanele. Siyabonga.
Asibonge kakhulu kuNgqongqoshe uMinister uDlamini Zuma. Ngizathatha leli thuba manje ngiqele uNgqongqoshe Ibrahim Patel uthi naye azothi qhaphu njengoba sesivula ke manje izimboni sekabekile uNgqongqoshe uDlamini Zuma ukuthi yiphi imininingwane ozawudinga ukuthi yena ilandelwe. Kodwa ngizawuqela ke through the Minister of Trade and Industry to come before us and indicate what are these areas that industry as they open need to adhere to. Minister Ibrahim Patel.
I would like to greet colleagues and members of the media and fellow South Africans. My colleague, Minister Dlamini Zuma, has set out the broad details of the measures that apply in Level 3. This is the most significant reopening of the economy since the lockdown began some 63 days ago. And it opens up all of our core productive sectors, from manufacturing to mining to all the productive services. It means that the country's steel mills and textile operations, the chemical plants, the plastic operations will all be able to operate at full capacity. The electronics and furniture and other sectors will all be able to produce both for the South African market and for export to the rest of the world. Level 3 opens up the rest of the finance sector, like microfinance and many other parts of finance, and all of retail that up to now has not been opened, whether it is the sale of appliances or furniture or electronic goods, all of the clothing industry, those are all open now through retail. There are a few limited exceptions which will be set out in the regulations and that my colleague has referred to, and I will come back to. It also keeps open all parts of the economy that has operated under Level 4. So all of agriculture and food production, whether it is livestock or crops, for export as well as for our own people. It keeps open the healthcare sector, the production of medicines and personal protective equipment, all the hygiene supplies, cleaning materials, hand sanitizers, and so on. And of course, the production of electricity and water and data services. When the lockdown was first announced by President Ramaphosa, the intention was to restrict the movement of all of us, to keep as many of us at home, except those who were undertaking the most essential services. And when the lockdown began on midnight of 27 March, there were only 927 confirmed cases of the coronavirus in South Africa. And that number has grown over the period. Initially, before the lockdown, we had a doubling of the number of infected persons every 2 to 3 days. And the lockdown has begun to slow that down. The lockdown has come at a great sacrifice to our people, to businesses, to workers, to consumers, to all of us who value the ability to do the things that we do every day in our normal lives. But it has brought us valuable time to put a number of measures into place. First, the slowing down of the virus, the spread of the virus, has avoided our healthcare system being overwhelmed even before health officials and personnel in the sector has been able to prepare for the surge of patients. So in this period, the time has been used to upgrade systems at hospitals, to build additional field hospitals and expand the number of beds that are available, and very importantly, to train staff in managing in a COVID environment. Because we saw in the rest of the world, the most critical thing was hospitals were crammed with patients, there were not enough beds, and hospital personnel were not ready. The second thing we've been able to do in the period up to level 3 is to build up the stocks of critical health care and personal protective equipment. We've built up the stocks of surgical masks, like the mask here, and the not only masks that have been produced for medical personnel, but also face cloths, face masks that have been used across the public. We've built up hand sanitizer supplies, surgical gowns, and ventilators. Some of this we had to import from other parts of the world while we got our factories ready to get production going in South Africa, and we've ramped up production very significantly. Just tomorrow we'll be releasing more of the details. We'll show samples of all of this, but some 38 million surgical masks have been acquired for the healthcare workers and those admitted to hospitals, and local producers, companies based here in South Africa, with South African workers producing more and more of these masks. Finally, we've also been able to introduce more healthcare and sanitation protocols at workplaces. This period has been used to introduce it, to run pilots, to see what works, to expand it. As more and more workers come back to work, the systems have been expanded. So most workplaces today have some rudimentary sanitation and protocol arrangements in place, and we now look to scale those up under level 3. Since the start of the lockdown, we've also built new structures of social solidarity between citizens and residents of our country, and raise resources. Some of it has been some new technologies and ideas. Others have been money that's been put into the Solidarity Fund by shoppers, and people have put small amounts into the bank accounts, as well as businesses that have contributed to the Solidarity Fund. So what we've now, where we've got to now is, how do we move from a strict lockdown to an arrangement that is more sustainable in the long term? When the virus first spread, we all recognized that the lockdown is a temporary measure. It's a blunt instrument. It's very effective because since we spread the virus as human beings when we move, when we keep ourselves at home, or largely at home, we limit the spread. So it's effective, but it also comes with enormous collateral damage. It hurts the economy. It causes significant and serious damage to the economy. So we developed in this lockdown period a set of sharper instruments or tools to deal with the spread. And it became known as the risk-adjusted approach that had 5 levels. We moved from level 5 to level 4. looking at their health and other data. We now are ready, as my colleague has said, and as President Ramaphosa has said, to move to level 3. During level 4, we monitored what was happening at workplaces and in the public very carefully to see what could we learn. Where are we making some mistakes? Where can we improve the systems? Where are our protocols weak and they need to be strengthened? If level 5 and to some extent level 4 was based on detailed regulations that were directed at having as many people at home as possible, level 3 instead is based on most South Africans being at work. That's the big shift in level 3. And the shift is therefore to a more flexible and collaborative set of arrangements, including regulations that enable businesses to do more. And so the focus does shift to businesses and workers, to consumers taking careful measures to avoid or limit the spread of the virus. In moving to level 3, we've consulted very, very widely. First, we published a framework that was put out for public comment. More than 70,000 comments were received on the COCT email addresses, and we had close to 1,000 comments by business organizations and individual companies, trade unions and others on the measures that we had publicized. After that, over the last few weeks, we've been working closely. The President convened meetings at NEDLAC, that's the National Economic Development and Labour Council, where we brought in the social partners. We've met with provinces through the Presidential Coordinating Council, with many business organizations across the economy, with the largest trade union federations and many individual unions. We've met with individual sectors like the auto sector, the food sector, the retail ones, those who produce clothing and chemicals and steel, and those doing the sawmilling for the nation. We've also met with players in e-commerce and those doing general goods. We've met with construction companies, small ones as well as large ones. And all of these consultations were directed at getting ready to increase production, but at the same time to protect workers and customers from a rapid spread of the virus. And it looked also, in this period, we looked at how can we avoid so much pressure on the public transport system during the rush hour that people are crammed together and they become important and key sites for the spread of the virus. And so this period has been about developing these protocols and getting everybody on board. Under Alert Level 3, many more economic activities will be permitted, with something of the order of 8 million additional workers that will be going to work, potentially more depending on how many companies take up this. It means that almost our entire workforce will be back at work. Although we should caution that the appeal has been made that those who can work from home should be enabled and encouraged to work from home. Special care, of course, as my colleague has said, must be taken in the workplace for those who are over 60 and those with comorbidities, to enable them to work from home where possible and to enable the workplace to be safer. In level 5 and level 4, we had very detailed lists of the permitted activities. In level 3, it's a big shift. It's a shift to setting out what is not allowed, because the list now is much smaller. And the list is restricted to only those parts of economic activity where the risk of infection is seen to be very high, and which brings a lot of people into very close physical contact with each other, where the 1.5 meter distance is difficult to maintain, or where the regular cleaning of surfaces is difficult to do, and where we need more time to develop those protocols, to work with those sectors and see how can we safely open up more of those sectors. The list of restricted activities have been mentioned by Minister Dlamini Zuma. It includes, for now, sit-down meals in restaurants. Of course, all the delivery services like drive-through and pick-up services will be opened, and you'd also be able to go to the takeaways and fetch your hot foods. If you go into a supermarket, you'd be able now to get the grilled chicken. But all of these will have clear protocols to ensure that we don't have people all waiting at the same counter, and these are risks of transmission. On-site consumption of liquor is not permitted, it's restricted. There are certain restrictions on hotels and guest lodges and backpackers and so on for recreational purposes. In other words, tourists who come for recreation. For business purposes, it will be opened. If you need to travel for work purposes and you need to stay over at a hotel, that would be enabled. There would be limitations on passenger ships for recreational purposes, and conferences and big events like your big soccer and rugby sports events. We have large numbers of spectators. That spectator component that would not be open during level 3. But I do want to emphasize that we'll be engaging on a continuous basis with all of these sectors to see at what point would it be possible for more activities to open up, what would be the protocols, and what do we need to learn from the reopening of the phase of the economy under level 3. There's some activities that will remain restricted in the short term until we have better protocols in place that we're working on, and they include things like physical care services like hairdressers and so on. But we want to work with them immediately, not wait very long to see what can be done to make those places safer, and is there an opportunity, what can we learn from what the rest of the world is doing, and how can we ensure that those places in due course can also open up. During level 5 and 4, we had requested the Companies and Intellectual Property Commission, it's known popularly as the CIPC, to use its BIZ portal to offer a service to businesses who wanted to register their companies during the period of the lockdown. So those would be for companies that believe they were essential services or permitted services. This helped us quite a bit. It was proof that the senior management of the company had looked at the regulations and believed that they were covered by the regulations. It helped government to see how many workers were in the economy already doing work, and it gave us a good sense of the size of the essential service business, food, hygiene, and so on, that was opened. As we'll now, in level 3, be having many, many more workplaces opening, with many more companies covered by this, the registration portal will no longer be operated from Sunday midnight, when, in fact, the regulations itself will deal with the relevant issues. On alcohol, members of the media will know that the sale of alcohol has been a contentious issue, with some debate publicly on the matter. Government had concerns that we had communicated at the time about the impact of alcohol-related injuries and illnesses in clogging up our trauma units and healthcare systems. We had concerns about the impact on transmission, particularly in public areas, when those who consume alcohol have a reduction in inhibitions. We were concerned about the challenge of maintaining the focus on staying at home when there were additional reasons why people traveled out of their homes. And for all those reasons, alcohol was not permitted in level 5 and level 4. Following careful consideration about what we sought to achieve with level 3, and extensive consultation also with the industry, we are able to announce in the regulations the detail that the President had spoken of when he addressed the nation. We met with supermarkets and bottle stores, with the people who produce the different types of alcohol, with taverns and other places that sell alcohol on their premises for consumption on their premises. And many of the players recognized that government's concerns were real, and that we needed to ensure that any reopening is managed very carefully. Of course, some of them would have liked a wider reopening. But in the course of the discussion, I think we built a deep understanding that this needs to be done carefully and it needs to be done in phases. So in level 3, it opens alcohol sale only for off-site consumption. And all sale of alcohol would be limited to Mondays to Thursdays from 9 a.m. to 5 p.m. It will cover both those places with what are called on-consumption licenses. In other words, a license where you can consume alcohol on premises, as well as those who have licenses only to sell for consumption off premises. They're covered by the regulations. But all of them, all of those types of businesses are required to ensure that alcohol is only consumed off premises. So to be consumed essentially at home. The industry has agreed, this is the liquor industry, that it will take a number of steps to address the risks of transmission at the shops, at the various places, and it includes the delivery of personal protective equipment like masks and so on to taverns and other places. We'll issue a separate public statement containing the commitments that the industry has made. The alcohol producing industry has agreed to continue to produce some industrial alcohol for hand sanitizers and disinfectant purposes so that we don't run short of those now that consumption or alcohol for human consumption has been reopened. As we open the workplace environment to greater economic activity, the focus shift, as Minister Dlamini Zuma has said, to what businesses need to do. In this period, it was about the regulations keeping as many people off the street and at their homes. Now more of the focus is what can be done in the workplace and by shops and others. So we've used the last few weeks to talk to industry. We've met with many of them, with trade unions and with business organizations, and we've met with food and consumer companies, with the car producers and the people who make the car parts, the construction industry, textiles and furniture and metal and electric cables, all of them. And in this, we've now developed some draft frameworks or compacts, which the regulations refer to. And these will be made public by the sectors in the next few days in the run-up to the 1st of June when workplaces open. For example, in the framework agreements, we cover things like personal protective equipment, social distancing, workplace hygiene, how to ensure that every worker is screened every day when they come to work and when they leave. We've looked here at how to stagger working hours, what can be done, what consultation would be necessary with unions to ensure that not everybody rush to the taxi at the same time in the morning or to the train at the same time in the evening. The agreements are comprehensive. They create a framework for ensuring a safer workplace environment. But even when we have these measures in place, it will still take extraordinary focus and monitoring that we adhere to. We're looking now at examples as companies open, more cases are coming to light of people being COVID positive. We've monitored the situation in retail stores that have been open for the last 6 weeks or so, and we've seen a worrying number of people who are infected. So it's really a call for vigilance and for ensuring that we take every step to protect the society, to protect the gains of the lockdown, which is that we've been able to limit the spread and to smooth it out. So it's called flattening the curve. It's really ensuring that we don't get a sudden spike in the numbers. I can point to the food and consumer goods sectors that have said they will make sure every worker has a basic supply of personal protective equipment, and they'll screen workers when they report to work. The automotive industry, for example, have said that they will make laptops and cell phones available to those who can work from home. And when workers return, everybody is taken through a training program, and we bed down the details of that in the agreement. In the construction company, they've agreed that workers will be trained on how to wear and remove all the personal protective equipment. They'll make facilities available for hand washing, and where transport is provided, they'll be working with the taxi industry and using their own facilities to reduce the numbers at any given point. Well, let me conclude by saying that in the regulations as set out by my colleague, it really opens up most parts of the economy with a small, limited number of sectors or activities that are not yet open. But we must now begin to shift to rebuilding the economy. The impact of the pandemic has been severe on the economy. It's been harsh, it's been painful, and it's been damaging, both in South Africa and across the world. And as we open businesses again, we must use all of our own efforts in government, as consumers, as workers, to support local manufacturers, including small enterprises, to promote the Proudly South African campaign. Because when jobs are created here in local manufacturers, they send a positive economic momentum right through the economy. They create livelihoods and they provide more resources in the society. Economists call this the multiplier effect. And by what we buy, by looking for the label, by supporting the local producer, by backing the small supplier, we can do so much more. And in a recent engagement we had with the big retailers, they too agreed that as a retail sector, they will promote the manufacture of local products. They'll support localization of supply and what they call import substitution as key planks to support economic revival and growth. And they too recognize the importance of growing the small business sector and employment creation. So as I conclude, it's to say that we've used this time now also to put protocols in place and have a range of sector compacts in different industries that will enable more workers to benefit from the health arrangements that have been put in place. We've learned from some of the lessons of what has been done in the last number of weeks, and we've refined the approach to be able to ensure that there's greater collaboration, greater flexibility, and greater working together in the period ahead. Trade unions will play a very important role, shop stewards and workplace representatives, in making sure that the message of being safe in the workplace is constantly reinforced, and we look to a period of deep partnership on the shop floor between managers and workers, and with government backing and support to keep our workplaces as safe as is possible. Thank you very much.
Thank you, colleagues, Minister Dlamini Zuma, Minister Patel, and Minister Lamula. We brought Minister Lamula here because he's working quite close with the team that has crafted the regulations. So he says that he'll be ready to take questions.
Minister, we have Mercedes Besant from SABC.
That was quick. Okay, Mercedes Besant. No, I have not even opened for questions. Okay, Mercedes, let's hear you.
Okay, I have two questions, one for Dr. Dlamini Zuma and for Minister Patel. I just want some clarity on the issue of consumption, the sale of alcohol, not on site, but for home consumption. I need clarity on the taverns. I heard him saying they're still talking to most of the liquor industry and so on. So the reason I'm asking this is that in areas where a bottle store is in town, that person might want to, if that person wants to buy a beer, the person will have to take a taxi paying 30 rands just to go to town. And it means the person might have to pay about 50 rand just to get a bottle of beer for 20 rand. So will licensed taverns be allowed, for example, to sell for off consumption? That is one question, because some of them might end up selling illegally. You also said, Minister Patel, I heard you said the workplaces are following all the sanitizing protocols. I just want to tell you that is not it's not true that everyone is following that. Even here in Mark's building, yesterday and today, some of the police who work at the checkpoint, they didn't even have sanitizers, and they indicated even for the surfaces. So they do not have it, and I had to end up giving my surface sanitizer. So the issue I want to point out of surface sanitizing is also very critical, because we end up getting problems when even at retail shops, when you ask maybe the cashier or so on, even just to sanitize the surfaces before they assist you. People, sometimes they just get lazy, they don't want to do that. And maybe one of the stressing points is that surfaces, it's not only your mask, it's not only social distancing, but when we're in the public places, surfaces, when a customer says, can you please sanitize before I put my goods, it should be done so. And maybe somebody shouldn't get angry. And then the second one is to Dr. Dlamini Zuma. The president
But that
said
is the third one.
No.
That
one
is the third one.
Okay, that's fine. It's a comprehensive one. Dr. Dlamini Zuma, the president said exercising can be done throughout the day. I would like to know, when does the day end? What time, according to the Corona Command Council, does the day end? And secondly, the president also said, you exercise as long as you don't do it in groups. But I have seen cyclists here in Cape Town cycling in groups without even wearing a mask under level 4 lockdown. And even sometimes the police and the law enforcement, they see them, but nothing is being done. I saw about 10 of them on Sunday morning. So what should happen to those who break the regulations, such as cyclists, when other people who are not supposed to meet in groups are being told you are not, because then they will be harassed, by the police. This is just about the fairness also in the application of the enforcement rules. That it's not to say I'm saying you must not cycle in groups or whatever, but fairness when it comes to enforcing the rules.
Thank you, ma'am. Thank you very much.
We have another caller online.
Hello, this is David McKenzie from CNN. I have a question for Minister Dlamini Zuma. Thanks for taking the time. We've been reporting on the sale of illicit cigarettes and found large-scale importation of banned cigarettes from Zimbabwe and other countries, and also cigarettes being sold at inflated prices on the street considerably across South Africa. Why continue with the ban if cigarettes are still being smoked and no money is going to the state?
Thank you, CNN. Next. Any other person? Okay, Noneva, from your list.
Yes, Minister. The first question is from Alex Mitchley from News 24, and the question is directed to the Minister of COGTA. It reads as follows: Minister, you have made the record of the decision available as to why the ban on tobacco sales was extended on level 4. But what scientific evidence was used to come up to the initial decision to lift the ban at level 4? Likewise, what informed the decision initially to lift the ban at level 3? Could you please give us detailed reasons behind these decisions?
Can we be clear? The ban on what?
Basically, the question is, what informed the decision for the ban of cigarettes at level 4 and why it was lifted for level...
What?
4.
Oh,
okay, let me read the question again.
Okay, yeah, just read the question, because I think we're all confused now.
Yeah. What scientific evidence was used to come to the initial decision to lift the ban at level 4? The initial decision.
Okay.
Likewise, what informed the initial decision to reinforce to lift the ban? Remember, there was the lift of the ban, then it was reinforced, and then it was banned again. So the question basically is what informed the decision to first lift it and to now not have it anymore?
Well, I'm not sure whether the caller has read and has understood what the two ministers have said, because the ban on tobacco remains. So I'm not sure what, but well, they will assist me. Ever since we started, we have not unbanned tobacco. So that's what might be confusing. We have not unbanned tobacco. Whether at level 5 and of level 4, we are now at level 3. We are continuing with the ban on tobacco. I'm just answering for the colleagues, because we have not unbanned.
I think he's referring to the initial announcement that the ban is lifted, which was then subsequently not lifted.
Oh, that definitely we have not lifted the ban either on tobacco, either at level 5 or level 4 or level 3. But indeed, all those are decisions of the NCC, NCCC, and Cabinet. And any other question?
Yes.
We have another caller on the line.
Yep. Caller, we are all ears.
Hi, good afternoon, Minister Mthembu.
Yeah, Baba.
Okay, I've got two questions.
Who are you?
Maria Sanyani from Power 98.7.
Oh, okay. Thank you very much. You can now go ahead with your questions.
The first question goes to both Minister Nkosazana Dlamini-Zuma and Minister Lamola. Particularly Minister Lamola. The special proclamation declaration made by the SIU to the Portfolio Committee of Justice in Parliament. Our understanding is that obviously it was supposed to be escalated to the National Command Council to give the SIU special powers to investigate corruption-related matters on COVID-19, considering that the government has put aside 500 billion rands for relief, and we have seen acts of corruption. So I just want to find out whether the National Command Council have already...
sorry, you have seen? You have seen a lot of corruption?
There's been a lot of corruption being reported during this COVID-19.
Okay.
During this COVID-19 processes. So the question is, the proclamation request to be considered for SIU to be given special powers, has it landed on the National Command Council, and how far is that process?
Okay.
And the second question to any minister, with the schools reopening on Monday, the 1st of June, considering the state of most of the schools in townships...
Can I just assist you there? These ministers were talking to the regulations that will kick in for level 3. There are ministers that will speak to their own areas of work. Those ministers includes the Minister of Basic Education and the Minister of Higher Education. That will happen tomorrow at 10 o'clock right here. Now, it will be up to you whether you want to continue, but I'm just trying to assist so that you don't ask these ministers who deal with regulations about schools when you have got the relevant ministers coming tomorrow at 10. Are we together? Oh. Well, I think I've answered your question. Can we take the last question before we take the second round, Nangam?
Vikas Berger from Netwerk 24. He's asking, will people be allowed on beaches for exercise, and will they be allowed to surf and play non-contact sports such as golf for exercise? He's also asking, has there been any decision or projection with regards to how long the whole of South Africa or certain parts with lower levels of infection will remain at level 3 before moving to level 2.
Okay. Colleagues, I don't know who wants to start. Ma'am Nkosazana. Oh, qale ngolamula. Akaza khuluma. You can use that mic, yes.
I can speak from here.
Yes.
Okay, thank you. I will start with the issue of the proclamation that has been reported by the SIU to Parliament. It is indeed on our table for processing, but obviously before you proclaim and ensure that that proclamation does goes to the President, there are legalities that have needs to be fulfilled, and that is what we are currently dealing with the SIU to finalize the legalities, the extent of the proclamation, for what purpose and for which specific issues, because there should be some kind of prima facie issues that the SIU deals with, and it will then that will take it to the President for his consideration. Whether there's a projections with regard to the alert levels for the other ones, we will attend to the other alert levels immediately after concluding this alert level 3, and the nation will be duly informed when that process has been concluded. We are not in a position to state that it will be done in a week or two or so, because it involves consultation, it involves including internal consultation within government. Hence, sometimes the promulgation of the regulations will sometimes take time. You can't really give a specific answer that by tomorrow morning, because of the level of consultation that is involved in the crafting of the regulations. And maybe I could answer this one with regard to training. From what time to what time? In terms of the regulations, the day is from 6 in the morning to 6 in the evening, and it is encouraged that people must not do so in groups. And the issue of compliance by members of the public, you will realize that from this stage level 3. The regulations place more responsibilities on the individuals themselves to take responsibility and to ensure that their close associates, family members also take responsibility and comply with the health protocols that we all have to comply with for our own safety and for the safety of the whole nation. It is not the responsibility only of the police to ensure that we are compliant. As South Africans, we have that responsibility, and these regulations take that into account. The police comes in at a stage where there is clear non-compliance by members of the public, and the first intervention by the police is to request you or to engage you to comply. That is what is expected. But then if people are not complying, then police will have to enforce the law in terms of the Criminal Procedure Act. But what we want to emphasize is that people must take responsibility for their safety, for their own health, for themselves, and for all of us. Thank you.
Thank you very much. If we can assist Minister Patel with that mic. Don't touch the mic. Yeah, touch there.
I did not touch the mic.
Yes.
Thank you. Well, thank you very much. There were two questions or comments directed to me, both from Mercedes Present. The first is, where will alcohol be permitted to be sold? Will it only be at the large supermarkets and bottle stores? And the answer is no. The regulations themselves would permit alcohol to be sold at any premise that carries a license, whether that license is for on-consumption or off-consumption. But the condition of the sale is that it can only be sold in sealed containers for consumption at home. So no one can consume it on premises. So to make that a bit more practical, it would allow taverns and registered shebeens and restaurants and so on to also sell alcohol, but subject to the condition. It must be in a sealed container, and it must be consumed. The consumer has to take it away from that premises in order to consume it at home. I should indicate that we have stressed to the industry the continuing risks, and they've undertaken to act responsibly, and we will be releasing more of that detail of the commitments the industry is making to ensure that the reopening of the sale of alcohol would not be accompanied by all of the negative problems that we anticipated. In addition to that, we've also engaged with the 9 provinces. Liquor is regulated both by national government as well as by the provinces. And a number of provinces have their own legislation dealing with this. So we met with the MECs responsible for liquor in the different provinces, and they now will talk to the liquor boards to ensure that there's some coordination so that those who have a license to sell alcohol for consumption on the premises only can now utilize that to sell it for consumption off the premises. I want to emphasize that no consumption would be permitted under level 3 for any alcohol that is consumed on premises. The second issue that came up from Mercedes was on the adherence to the protocols, and particular attention was drawn to the surfaces that needs to be public surfaces that needs to be constantly disinfected. Members of the media and South Africans watching here today would see every time we use the microphone, then there is an official who comes and just quickly disinfects it. And that is done so that if any of us are COVID positive and we touch a surface, there is a possibility of leaving the virus there, and the next person who touched that surface then picks up that virus. The minute they touch their own face, there is a possibility of transmission of that virus. So that's one element of a range of measures. And Mercedes correctly pointed out that there's not 100% adherence. As I noted in my remarks, we've seen an increasing number of workplaces reporting big levels of infection. We saw it in the mining sector, we saw it in retail, some in factories and other places. That is an enormous risk that we must try to manage and keep the numbers as low as possible, try to use every reasonable means to avoid the spread and the fast spread of the virus. So what are we doing about it? Well, there's 2 sets of things we're doing. The one is to make sure that what needs to be done at each workplace is clearer to everybody. So from government, we issue directions. The Minister of Employment and Labour has now issued a consolidated set of directions that indicates in every workplace what is required, the distance that one must be from a worker, the sanitation procedures that needs to be done. I issued a similar set of directions for all call centers, indicating that they must ensure that when workers clock in, any of the biometrics don't require a physical touch, or if it does, that it's made COVID safe, and that the wearing of masks at workplaces would be required, that surfaces must be disinfected. In addition to our directions as government, we've also sat down with industry, and a number of sectors have now agreed to guidelines or compacts, agreements that would set out what is expected of every company in that sector. We'll be releasing details of that over the next few days. Many of them have been concluded. More are in the process of being concluded. I read out a list earlier of sectors like textiles, the car making sector, retail, that will be doing all of this. And then, as my colleague had indicated, every workplace must have a workplace plan indicating the measures, and that must be a written plan, so that at any point an inspector, a shop steward, anyone can come in and say, let's have a look at the workplace plan and how we can work together on that. But that's just, let's call it the intention. The practice depends on monitoring and compliance, making sure that if a company says it will do this, that it actually does that. So we have asked industry associations to play a stronger role with their members. Of course, there are government inspectors from different departments that will also be able to go to workplaces to check that the safety of workers and of the public are being looked after with the necessary measures. But I have met with the leaders of all the major unions in the country over the last few days to get their support, to get the tens of thousands of shop stewards at different workplaces working with the management, but also advising government where there are instances where in a particular workplace there is no adherence to the measures. And in addition to that, every workplace must have a COVID compliance officer. It's not just left vaguely. When an inspector comes in and says, who is the officer, that person is to come forward. When the inspector or a worker himself or herself working there says, but hang on, where is the sanitizer that the directions talk about? Then there is a named person, somebody known to everybody in the company that's responsible to ensure that. We sat with industry to say, retrain all of your health and safety officers, to bargaining councils, retrain your inspectors so that we have large numbers of people who can just reinforce this message at every level. And ultimately, the most important guarantee of the system is that South Africans, citizens, residents, consumers, workers insist that there has to be reasonable measures consistent with what government has published, that this is a system of greater collaboration. It's not going to be all down to regulations. We needed to rely on regulations in the early phases, level 5 and level 4, but we have to shift now to much more agreements, much more implementation of guidelines, and much more working together at the workplace. So when we see examples as the one that Mercedes have pointed to, please raise it with the management, ask to speak to the COVID compliance officer, point out the problem, and we are building a system. It's not going to be perfect. And every time there's cracks in the system, that's where the virus comes through and infects human beings and leads to the challenges and the fatalities that we've seen in the country and elsewhere in the world. Thank you.
Great, thank you, Minister. Minister Dlamini. Yeah, you can use that one. Yeah, it's gone.
Hello, okay. Thank you very much for the questions. I think most of them have been answered by my colleagues. Maybe I'll just add to one of the questions about whether there is projection of when we are going to level 2. I think we're just going to enter level 3 on the 1st of June. And depending on how the pandemic goes, how the virus goes, we can't tell right now, as my colleagues have said, when we will be able to go to level 2. But as we are entering the differentiated risk, so it may be that there may be places that may go to level 2 before others. But for now, we're all going to level 3 with the hotspots where more stringent measures may be announced. So that one, and I think the minister also did talk about exercise. We must do what the president said, not in groups, 6 to 6, social distancing, masks. And in fact, it's those things where people do not keep to the health protocols that fuel the spread of the virus. So it's important that we do so. About the cigarettes, I think it's important that where there is crime, crime is attended to.
Yeah.
If you see crime, report it to the police, let the law takes its course. So if people are doing anything criminal about cigarettes, the law must take its course. The rest, I will not say much because this matter is in court as we speak. We were taken to court about cigarettes, so there is plenty of scientific evidence, and it will all be aired in court as the matter is in court as we speak. I think the schools, the matter has been clarified that ministers are going to come and talk about their different departments and sectors. There's somebody who asked me also about higher education. The same is the answer, that the higher education will be, the Minister of Higher Education will clarify what the plan is and answer all the questions. There's somebody who sent me an SMS about opening the churches, and I think it's important that nobody is forced to go to church, because the person here says we are sending people to the slaughterhouse by opening the churches. So nobody is forced to go to church. The government has just opened an option, and there are very strict and stringent measures that have to be followed when people go to church. Not just the numbers, but what must happen, and it will be published. These measures will be published. But as we said, also people who are over 60 are encouraged not to go to church, just as they are encouraged to work at home if they can. But there is no one government is not forcing people to go to church. It's an option that is being opened, and if people feel they don't feel safe to go to church, they shouldn't. That would be my answer to the SMS here. I think those were the questions. Yeah.
Thank you very much. We will now take the second round of questions. Do we have anything online?
And maybe let me just say, on the sports issues, the Minister of Sports will also come, and he will clarify all the questions about sports. Thank you.
Thank you very much. Any online? Okay. Nangal?
We have a question from Fadima from ITV Networks, and her question is, Ministers' shopping aisles are very close to each other in supermarkets. People come close to each other while passing and choosing groceries. Even packers are busy while people are passing from both directions, which puts them in a difficult situation, which makes social distancing quite difficult in these situations. How can this be addressed? The next question is from Miriam Issa from Finweek, and it goes as follows. In his address announcing permission for religious gatherings for up to 50 people, the president said that that government wanted to take care of the spiritual, psychological, and emotional well-being of South Africans. This being the case, why are people who do not attend places of worship still prohibited from visiting their friends and loved ones? Is this concern for the psychological well-being, which the president spoke to, limited only to people who attend religious gatherings where the infection rate is high, even with protective measures? The next question is from Wonga Sehai from Inkonjana FM. And he's asking, there have been suggestions for people who are 60 years and above to work from home. Has the NCC looked at situations wherein there are teachers who are above the age of 60 who would have to go back to school since schools are opening? He's also asking, does the opening of churches also mean that traditional gatherings are allowed, since some people use traditional gatherings for spiritual guidance? Can I continue?
No, well, how many do we have? Can you give us the last one?
Okay.
You seem to be having a bucket full there.
Yes, indeed, Minister. There's a question from Anton from Pretoria News. He's asking, President Cyril Ramaphosa said in his announcement on Sunday that collection of food will be allowed, but there's no mention of the collection of food in the regulations. Does this mean that it is no longer allowed? And his last question is, are domestic workers allowed to go back to work? Thank you.
Can you clarify collection of food?
Yes.
Or dissemination of food?
Collection of food from restaurants.
Oh.
Yes.
Okay. I thought that maybe they mean the dissemination of food parcels. Colleagues, who wants to start? Maybe the one of the schools, can we allow the relevant ministers to respond to that tomorrow? It's not too far from now. It's tomorrow morning. Maybe let me just alert South Africa that from here, after these ministers are done, at 5 o'clock, we will have the ministers that are dealing with the JCPS, police, defense, home affairs, justice, coming to also put their preparedness for level 3. Then tomorrow morning at 10, we'll have the social cluster. The social cluster includes ministers of higher education, ministers of basic education, ministers of social development, minister of health and others. So we will have, of course, minister of arts, culture and sports. They will all be here. And then in the afternoon tomorrow, we'll have the economic cluster with ministers of employment and labor, ministers of mining and minerals and energy, ministers of land and agriculture, Minister of Trade and Industry. I don't know whether he'll come back again because he's here. So we have all these ministers coming to speak to us as South Africans on what is the preparedness of the various clusters for level 3. That answers the school's question. Colleagues, Minister Damula.
I will answer the one of gatherings. That all gatherings are prohibited, except the gatherings that were specifically allowed in terms of the regulations for faith-based institutions. As the minister has already said, a funeral, a gathering at the workplace for workplace purposes, an agricultural auction, subject to the direction issued by the cabinet member responsible for agriculture. So those are the only forms of gatherings, including the one that we have just mentioned of a professional non-contact sports, which may only include players, match officials, journalists, and medical and television crew, as per directions issued by the cabinet member responsible for sports. And I think he will further elaborate on that. So these are the only gatherings allowed at this stage. Thank you.
Thank you very much. Minister Patel, any?
Thank you very much. The question that was posed about shopping hours and the impact on density of shopping, we're constantly looking at how to ensure that we have the shopping environment as safe as possible. And as level 3 now opens up, many more stores will open. This may have the effect in part of distributing people more evenly during a trip to the shopping mall. But there are risks as more goods are sold even in the traditional grocers, that we'd have more foot traffic, which is why in the earlier phases there were a more limited number of goods. But as the goods increase, there's no question that there will be more pressure. It's an area we've got a forum where we engage with the CEOs of retailers. So we'll be keeping an eye on this, and as and when adjustments are needed, we would need to make this. This is the essence of the collaborative approach. It's that we're in this together. It's not government want to restrict someone. It's that we need to work together to limit the spread of the virus. On the question whether domestic workers are able to return to work, the answer is yes, they are able to return to work, subject, of course, to the health protocols being followed. There are particular challenges sometimes in a domestic environment, and we will be looking to see whether the existing directions may need to be elaborated or expanded to provide for circumstances like that. But even as domestic workers return, it's absolutely vital that it be done in those circumstances where it can be done so safely. On collection of food from restaurants, where you place an order with the restaurant and you go and pick up your food, that is permitted under level 3. We encourage everybody to do the ordering by phone or online, so that there isn't a need to wait at the restaurant, because it's those moments when people congregate and one person sneezes or coughs or someone touches a surface that someone else then touch, that there are greater risk. If we can keep people moving quickly, if the store owners can disinfect the surfaces, if some drive-through arrangements are used and curbside delivery arrangements are used, all of those can help to reduce the risk. We can't eliminate risk completely. The virus will spread. It's how to avoid it spreading so fast that it overwhelms the healthcare system, and that's what we're seeking to do. And for that reason, a lot of our discussion over the last number of weeks has been to explain the rationale or the logic of the risk-adjusted approach to more and more constituents, to take everyone into our confidence and say, it's not really about finding a loophole in the regulations. It's working with us to get the intent and purpose of the regulations embedded in the practices in a workplace, and that's what we're seeking to do more and more. We look at the impact that the spread of the virus can have in a particular workplace, but we also look at the impact that it can have when many workplaces are opened at the same time. There are some sectors where more work needs to be done with that sector. There are some sectors where we need to just learn from level 3 and see what are the learnings that can be taken to the additional activities. But most economic activities have opened now. The value of the phased opening, the step-by-step, is we can learn as we make some mistakes, as we have lapses, as one of the journalists pointed out earlier, where a particular building in Cape Town was not sanitizing the surfaces properly. As we learn those things, we can incorporate it as we open up. So that's the essence of the risk-adjusted approach. Level 3 is about taking that risk-adjusted approach and saying greater responsibility on workplaces, on businesses, greater role and responsibility that health and safety officers, COVID officers, and COVID compliance officers, and of course, importantly, shop stewards can play in helping to make the working environment a safe one. Just as in normal times, many trade unions focus on improving the standards of living of workers. In this period, a lot of the work and the collaboration and partnership must be about saving lives, because we've balanced the importance of saving lives, and we've also focused on securing and protecting livelihoods. Thank you.
Thank you, Minister Patel. Minister Dlamini-Zuma.
I think Hello. I think all the questions have been answered.
Okay.
Thank you.
Thank you very much. If we still, sorry, my apologies. If there are still questions, I see that you had a load truck full. Nongcebo.
Yeah.
Oh, do we have somebody online?
Yes, Minister, we have two callers. The first is Alex Mitchley from News 24 and Guillaume Bogo, ENCA.
Alex?
Good afternoon, Minister. I just want to clarify my question. Essentially, before the U-turn was made on the ban on cigarettes, the President announced that they would be lifting the ban on cigarettes. I'd like to know what science and evidence was used when the President announced that lift, despite the fact that there was a U-turn. And then the same goes for, it was still put into level 3 that cigarettes would be allowed. This was obviously changed again. So I want to know what science and decisions was that based on, despite the fact that you guys eventually decided to continue the ban. That's my first question. My second question is, were there experts or scientists consulted on the ban of tobacco products? From the court papers, it appears that only studies were used that affirms government's position. Did you weight these studies against other studies that came to different findings? A good example could even be the UCT study that found 90% of people were still smoking.
Before you continue, you are saying you are aware that this matter is before court, isn't it?
Yeah, sure, but this information would not be sub judice.
Who says that? Is it you?
To my understanding, at least.
Definitely, any matter that is before court can't be discussed in a public, because we are preparing ourselves to defend ourselves in a court of law. Can we allow the court process to continue without being disturbed by ourselves?
All right.
Thank you very much. So we are not going to answer to that question because from our understanding, it is sub judice.
All right, thank you, Minister. In that case, the data around obesity and COVID-19 mortality appears to be a lot stronger than smoking. Therefore, fast food and fizzy drinks will obviously be pretty dangerous. So why wasn't a ban considered on these to protect against the same possible outcomes as cited for the ban on cigarettes? That's all. Thank you, Minister.
Yeah, kunzima serious. Next. Vuyo?
Yes, Vuyo Mbogo, ENC. I heard the minister saying, pointing to the obvious fact that no one is forced to go to church. But of course, I mean, we have a history here of people who are desperate to be healed of their sicknesses or who want to be comforted, getting exploited by some of the religious leaders we've seen lately. And on top of that, it is a fact, it's been proved that mass gatherings have made a big contribution in the rising numbers of people infected by the virus, as we have seen in places like the Eastern Cape on the back of funerals there. Which then brings me to the question, what actually persuaded the NCC to change its decision on religious gatherings, and why was the announcement not made by the President on Sunday and was rather made like a couple of days later?
By the way, let me answer the question for you. First of all, you will know that the President has been meeting with various sectors, and the ministers have said so. Various sectors and various groupings, including the faith groupings in our country. And indeed, the President did indicate in his address to the nation that he is continuing these meetings with our faith-based organizations. It was after he had concluded these meetings that the President then came to the NCC. When did we have the NCC? On Tuesday. On Tuesday, where indeed the NCC then took the decision based on the consultation that had been made, that we should, on the strength of the evidence that and the discussions that had occurred between the president and faith-based organizations, that the churches, synagogues, and mosques should be opened. That is the decision of the National Coronavirus Command Council. Of course, also a decision of our cabinet, and informed by the discussions that have been held between ourselves and the faith-based organizations. That's why then the president later on Tuesday then spoke on this matter. I hope that you are aware of these timelines, Vuyo. That
yes, but can't you enlighten us on the arguments as Minister Dlamini Zuma did with cigarettes, for example?
On the arguments,
as the sense that we understand what the issues were, because and I'm not coming from any particular sort of ideological premise. I'm just trying to understand that in the management of the pandemic, where it has been proven that an assembly of groups of people contributes to the rise in the numbers of cases. So what persuaded the president or whoever took the decision finally that this was the way to go? It will help the nation, I think, if we understand
first
the
of
logic.
all, we have agreed funerals to be packed at 50 people. And as you will also know, funerals normally start in these houses of worship. Let's first start there. So you have got 50 people who attend a funeral, who starts at the house of worship, and thereafter proceeds to a place where the person will be laid to rest. The argument by churches was that if you have allowed 50 already, does it make any sense, or is it rational for you to disallow churches if they maintain the 50? If they maintain the 50, the same number that we have allowed for funerals, the same number that comes to churches for funeral purposes, why would you not allow the same number? Now, where you are not correct, we are saying even the churches, this is what the ministers have said, will have to adhere to the health and hygiene measures that we have pronounced, including social distancing. So again, key to this hygiene measures is that you cannot have more than 50 people in any worship house. So normally our churches, I don't know whether you know how many people go to our churches. Normally, we have loads and loads of people coming to our churches. That has now been curtailed to the number 50. But also, that number must also ensure that there is social distancing. The Minister of Culture said, if with social distancing the church can't take 50, the church will be then forced to take lesser numbers. Of course, also the church must adhere to the other prescripts, health prescripts, including mask, wearing of mask, including the washing of hands, etc., etc. We think that as the NCC and Cabinet, we have taken the necessary precautions that churches and protocols that churches must adhere. By the way, those protocols are also in our regulations. Those protocols are in the regulations that we are gathering. They are in the directions that we are putting forward, how churches should arrange themselves, what are the numbers, and what are the measures that they should adhere to. So we have taken all the precautions. Let me go again to one question that has been raised. Somebody said that the church activity in the Free State contributed to the spread of the disease. Yes, but there were no measures there. There was no number 50. There were no masks that were prescribed at that time. Also, there was no social distancing. There was no washing of hands at that time. Equally, even the difficulty that we had in the Eastern Cape, that difficulty arose because these measures had not been put in place. Can we allow the churches to practice these measures and open? And again, the churches, by the way, have said to all of us as government that they will adhere to the spirit and every detail of these measures that we are putting in place. This is what informed the decision of Cabinet. This is what informed the decision of the National Coronavirus Command Council to open for the churches, because they are ready to implement all these measures that we have put in place to combat the spread of coronavirus. Similarly, by the way, if you make these measures applicable to industry, indeed we have opened the industry. The Minister of Trade and Industry has just said over 8 million people on the 1st of June on Monday will be going to work. Various sectors of the economy will be open. On what basis then do you say a church that says we will also observe these measures that will be observed by all these other categories that will be open, on what basis do you then say they cannot open? It became very difficult. So we are leveling up with you, Vuyo, but also leveling up with the people of South Africa, that all our churches, all our mosques, all our synagogues will adhere to all the measures we have put in place. They will adhere to social distancing. They will adhere to the prescripts around health, including washing of hands. They will adhere similarly to wearing of masks in the churches, because this is the law now. So all of us will adhere to this law, and all church leaders in their meeting with the president and members of the executive have said, President, we are ready to adhere to all these measures. On what basis would we then have said, no, you can't open? I don't know whether you want to add anything, colleagues, or have I covered you? No, you are covered. Very well. Very well. Thank you very much. I hope that explains. In fact, by the way, the Minister of Trade and Industry has also said there are some sectors that we have not opened for now. But these sectors, if they come to us and say, by the way, will not be sectors that basically allow the spread of the disease. These are measures that we have put in place. In fact, there are discussions that are ongoing as we speak now between some ministers and some sectors. So our preoccupation as Cabinet and as the NCCC is whether there are measures in place to combat the spread of the disease in any sector, not only in the churches, but in any sector, including the sectors that will be opening on the 1st of June 2020, this coming Monday. I hope I've answered your question elaborately, Vuyo. Was there any other question?
Yes.
Yeah.
Just a reminder on the question on domestic workers, whether they are allowed to go back to work.
Oh.
Okay.
Yeah, who wants to answer it? Okay, Minister Atlan.
Maybe we can. Yes, they are allowed to go back to work.
Yeah, they are part of the working sector. All workers are allowed to go back to work on condition that they adhere to the measures that we have just spoken to, including domestic workers.
And also, some of them are actually a support structure for those who are going back to work,
True, yes.
Especially also essential workers and others.
Thank you. Langan?
Charlotte from EWN is asking what kind of notice will be given to hotspot areas before their lockdown status is changed? Will it be a matter of days or hours? And she's also asking how much thought was given to the knock-on effects of allowing alcohol to be sold again, especially given the extra burden this will place on trauma units and the health system at large. Then there's a question from Jill from CCTV Joburg. Families have been separated from older parents and working children who live in different towns and provinces now for about 63 days. What is available for families within provinces to see each other, and will families be allowed to see each other interprovincially as well? Then Rose from News SA is asking, will weddings be allowed under level 3? And just an added question to that is to just clarify whether those people who will be going back to work under level 3 will need a permit to go back to work. James De Villiers from News 24 is asking, will professional sports matches be allowed, and what will the conditions be?
Can we hold on that question? The Minister of Arts, Culture and Sport will be here to explain the circumstances around sporting and arts.
Okay.
I think it's tomorrow. Is it tomorrow?
On Saturday.
On Saturday, yes. Yeah.
Lamise from Fin24 is asking, may the ministers please provide clarity on why hairdressers and beauty services may not operate under level 3? These are industries which are arguably highly sanitary. And there's also...
Is that not the fifth one? Can you count? Thank you very much. I think it was the fifth one. Okay. Who wants to start, colleagues? Lamula. Lamula, you want to start?
No.
Okay.
This time, no.
Okay. Sis.
Thank you. Weddings for level 3 are not allowed yet, but people can get married. It's just the wedding celebration. As far as I know, you can go and get married, get a certificate, but it's the actual wedding celebration that
the party.
The party, yes, that is not yet allowed. And then I think the Minister Mthembu has said that there are discussions with saloons and with other industries to look at how because there is no social distancing. So we're looking at what other measures that need to be taken to mitigate the fact that if you are cutting somebody else's hair or you are doing somebody else's face or nails, you can't be 1.5 meters away from them. So the discussion is going on to see how that can be mitigated. And once that is resolved, the matter will then be concluded and they'll probably be opened. So discussions are ongoing. There may be what we may call enhanced level 3, where if those matters are concluded, more regulations can be put in place to enhance the ones that we have. That's the question on hairdressers, that's the question on weddings. So for now, I'll answer those. Thanks.
Yeah. Minister Patel can answer the others.
Thank you very much. On the question that was asked about permits under level 3, what's required for those going to work is simply something, a letter that's issued by the employer. In the regulations, the form of the letter is set out. I think we recognize that as more and more people go to work, it becomes important to shift the focus on other measures, such as maintaining a safe workplace, ensuring that we take the pressures off the public transport system. But we should, within the limits, we're strongly encouraging everybody to limit the amount of movement. And as the President indicated on Sunday, leaving the house is really for the reasons specified. And that is set out in the regulations. And the President had given an indication of that on Sunday. So we are looking here for simplified ways of doing things, but that letter that the employers give out to workers would still be in the regulations. On the question of travel, I think all of the travel-related questions had been addressed earlier, but if there's any specific question that we haven't covered, it can be brought to our attention. On travel between provinces, I think the regulations set out the circumstances there. Of course, as more of the economy opens up, we will see a significant increase in travel between provinces. Our key concern is to ensure that when we have a hotspot, that the infection rates out of that hotspot don't affect the surrounding places and other parts. So a measure of caution is still necessary until we're able to dampen down all of the key hotspots. In some of the larger hotspots in Cape Town, for example, the rate of infection is significantly higher than the rest of the country. And if that level of infection had to be obtained everywhere in the country, it would place our healthcare system under such severe strain. There won't be enough hospital beds everywhere in the country to manage that. On the notice in respect of hotspots, I think those are issues that we're looking at. What is the rate of infection? Is it increasing or is it beginning to stabilize? Are the other measures that government is putting in place, sending medical teams, epidemiologists and practitioners and healthcare workers who can do screening in an area, working more closely with local authorities in the area, ensuring that special measures are taken in respect of shops that are open in the area. All of that is intended to have an effect. If those don't work, then we just have to use more tools in the toolbox. It gets escalated. How much notice will be given? But it depends really on how serious the challenge is. If we suddenly face with a massive spike and it's growing at an enormously fast rate, then there will be very little notice. If we're seeing an increase, it is worrying, but it's increasing at a steady and predictable rate, there's more chance for other interventions and for notice. So this is like any fast-moving thing. We've got to keep a degree of flexibility in the approach that we take. On the knock-on effect of the sale of alcohol, I think the caller from, I think it was from EWN, summed up very well the concerns that government had, which meant at level 5 and level 4, it was imperative, while we tried to buy space for the healthcare system to ensure that we don't have the additional burden of trauma patients as a result of alcohol-related car accidents and physical fights and shootings and so on. Those problems don't disappear under level 3. It's not as if the potential dangers are not there. And for that reason, we've taken the view and we've communicated intensely with the industry that it can't be an immediate and blanket reopening of the sale of alcohol in the same way as it was before. There are defined days, there are defined hours, there are special measures that will be set out either in the regulation or in the directions that we issue. And in addition to that, the industry itself will be held to the commitment that they've made to government, that they will take strong and active steps to try to dissuade and discourage binge drinking and the kind of abuse of alcohol that has seen our trauma units absolutely filled with patients that are in some or other way related to alcohol-induced challenges. So instead of a fight over does it or does it not, I hope and I think we've shifted the discussion with the alcohol industry to say, recognize that these problems are real. Now work to see how we can reduce the level of that problem. Of course, we will have to see as the coronavirus levels rise in future, and they will rise, what impact that will have on our healthcare system and what adjustments, if any, we will have to make to secure the space in hospitals to save lives. And that's why the more responsibly we can get the industry to act and the lower the burden on the public and private healthcare system for that matter, the greater the prospects that this collaborative approach can be sustained. But you raise, I think, the fundamental dilemma for public policy. For every action that we take, there's an argument for and there's an argument against. And really, in level 5 and level 4, we were very, very cautious as government. In level 3 and level 2, it relies to a much greater extent on collaboration and working together. It requires more flexibility in the regulations to enable that, but it still means that the outcome that we want is exactly the same. Saving lives, reducing the spread of infection, pushing out the peak as far as we can, putting more effort, money, and resources into building up the hospital capabilities and the systems in hospitals. The President mentioned a major automaker, VW, that is building a hospital in on premises owned by the company, where 4,000 beds will be available. We also have another automaker in the Eastern Cape, Isuzu, that has made their team of engineers and workplace specialists available to go to the local public hospitals and refurbish it, clean it up, improve the flow so that patients could go through more easily, and expand the isolation facilities that are available. The President has made an appeal to businesses when he met with business leaders before the announcement of level 3. And he said to them, we are contemplating a move to level 3, but we will need your support. We will need your support in expanding healthcare facilities and, importantly, also in helping us to secure additional quarantine facilities for workers who are affected by COVID-19. So you will see in the weeks ahead a greater focus to those collaborative measures that are necessary and that we think can expand, hopefully, the capacity we can draw on as the number of cases rise. At the same time, we need to do everything possible to also reduce the spread of the infection. So it's a combination. Do things that will lower the spread and at the same time build more capacity to manage a greater number of South Africans who will be COVID positive. I think, colleague, those were the additional questions that I could answer.
Thank you. Minister Lamola, you're good. Kule bus load yakho kusele ngaki?
10.
Hallelujah. Can we take 5?
Okay. Sorry.
Which is the last 5?
The last 5. Okay, I'll take the last 5, Minister. John Fraser from ZA Confidential is asking, Minister Patel had referred to directions for call centers and is asking whether those have been made public yet. Then there's a question from Jan Delanga from Rapport. It's also directed to Minister Patel, and is asking, is the Minister considering price controls on basic foods like bread and fresh produce in areas where small local producers have been disconnected from their markets, and the five big suppliers has increased prices due to increased demand for these basic foods? And is also asking whether any special arrangements have been agreed upon with the liquor industry to prevent the initial rush that is expected on Monday morning, when the sale of alcohol will be allowed again. Mike Cohen from Bloomberg is asking, why do parks and benches remain closed? Parks and beaches remain closed. This does not cause crowding in any other places where people exercise? Basically asking why are we not opening beaches and parks. Peter Detroit from News 24 is asking Minister Mthembu to clarify. He says, Minister Mthembu says evidence was considered in meetings between the president and religious leaders before the decision was taken to reopen places of worship. What does this evidence entail? What is the evidence based on? And given that churches in Korea and in Bloemfontein were considered super spreaders of infections. The next question, which is the last one, from Evelyn from Caxton, Durban, and it's directed to Minister Patel. With the reopening of microfinancing enterprises, what controls is being implemented to prevent people from becoming seriously over-indebted out of desperation due to hardships like job losses resulting from the pandemic? Does the minister have any idea if this is going to increase the repo and lending rate? And she's also asking, what is the stage going to use to replace the state? I think she wanted to say the state. What is the state going to use to replace the taxation income loss resulting from the ban on products that usually attract sin tax? Thank you.
Sin or sin tax?
Sin tax.
Or sin tax. We test sin tax.
So, Minister,
okay.
Minister, we have one caller from Finwick.
Finwick?
It's Marian Isa.
Oh, that caller is coming back again. Kolomasis. We are listening. Well, we don't have the caller. Let me answer the question again directed to me. What is the reasoning for opening churches when they were seen to be the spreaders in the Eastern Cape and the Free State? Now, we have answered the question. We said in the Eastern Cape, as St. John's, when that spreading happened, it was because, amongst others, they did not have the protocols that we have now. Similarly, even in the Free State, there was no social distancing. The churches could accommodate millions or thousands of people at the same time. We are now saying churches can only accommodate 50 people. Even with the 50 people that can be accommodated maximum, worshippers, there must be social distancing, even amongst the 50. And if the social distancing makes the place not workable for 50 people, then indeed the churches might as well go to 40, 30, but they can't be more than 50. So these are rules and laws that we have put in place to ensure that there is no spreading as it happened earlier on in the churches. Secondly, we are saying, indeed, even the churches must adhere to the hygiene and health protocols of sanitizing as people come in and ensure that, indeed, we are not having the problems of touching and hugging This will not only apply to churches, but to all of us. We are no longer touching, we are no longer hugging. So this protocol will also apply to churches. We believe with all these measures that we are putting in place, the opening of churches does not pose the risk that they would have posed had we not put in place these measures. Therefore, we are quite convinced that we have done everything in our power. Of course, working with the faith sector. We are a government that is consultative by its very nature. We have consulted with the churches. They have agreed, by the way, to all these measures. That you won't have a synagogue, you won't have a mosque or a church that will have more than 50 people at any given point in time. But even those 50 people or worshippers will be subjected to social distancing and all the other measures that we have spoken to. So we believe all these measures really mitigate against the contracting of coronavirus in our churches, in our synagogues, and in our mosques. So I hope I've again answered the question. Who wants to come in now? Patel, yeah, Patel, you seem to be most loved this evening, this afternoon. They love you to bits.
Okay, no, thank you very much. With so much love from the media, how can I go wrong? First, let me start with the question asked by John Fraser, which is the call center directions. Has it been made public yet? The answer, John, is that I issued it on the 9th of April, and it was published in the Government Gazette. It was then used as the basis to reopen call centers, and it provided a set of directions and measures that every call center needs to have in place. And I gave some examples of it earlier, and those included things like that there must be a 1.5 meter gap between workers when they are working, that no workers would share the same utensils in the canteen or the same equipment on the in the workplace. It included measures to require the company to think carefully about clocking in arrangements in the morning, because these call centers employ large numbers of people. In fact, South Africa has become a major location for call centers, not just for businesses locally, but in fact for global companies who see South African workers are skilled, they are flexible with language, they're able to utilize what they've learned locally and provide answers to the problems that customers of big global companies have. Those operations have restarted, so the value of that direction has now been realized. We've also taken many of the learnings from that and incorporated in the regulations issued by the Minister of Employment and Labour, and that too was publicly announced. Let me come next to Jan's question on price controls and rising prices of basic foods. There are two challenges with rising prices. The first is when prices rise because your core costs have gone up. For example, if we buy wheat from elsewhere in the world, we import the wheat. When the rand is weaker, every ton of wheat costs more because the price is in dollar, and as the rand value declines against the dollar, you need more rands to buy the same quantity of wheat as you bought before. Now, there's not much we can do about that because that's outside the control of anyone. But there's a second reason why prices rise, and that is because someone in the supply chain decides, here's a crisis, People are desperate. Let's put up our prices because they don't have any alternative. When that is done, it is profoundly unfair to society in circumstances where we're battling a life or death crisis, where families have had the incomes slashed and so many workers have been with either a limited income or no income, when businesses have been on hold and some firms are staring collapse in the face. In those circumstances, we really need to pull together. And so we are using our legislation, the Competition Act as well as the credit legislation, to act, the consumer legislation rather, to act against companies and middlemen who seek to exploit a temporary shortage by rapidly raising their prices. Tomorrow at the separate press conference for the economic sector, I will provide some information and data on the extent of actions by the authorities to deal with that. So we're keeping a careful look at prices. The retailers and producers have said that they will not unnecessarily increase prices, and through the various measures available to the state, we are, of course, monitoring what is happening there. Jan, on your question on special arrangements for the initial reopening of liquor stores and places, well, we've done two things. The one is we have agreed that we would enable the opening not just of the normal retailers that sell for off-consumption, that we'd also open more widely, as I indicated earlier, the taverns and shebeens and restaurants and so on that sell alcohol. But as I've indicated, it would only be for off-consumption sale. In other words, in a sealed container, and it has to be consumed at home. So that will hopefully reduce the number of persons who come to any one place. We have asked the industry, we've said to them, we can either regulate this matter or you can self-regulate. They have indicated that they will take firm steps to reduce that rush, and I think we will hold them to that. And they will need to pull out all stops to make sure that there is not the kind of rush that we've seen elsewhere in the world when liquor stores opened up. And social distance will be absolutely critical, but we also call on South Africans to cooperate with each other very carefully to maintain the 1.5 meter distance and to take every step to avoid being infected. Evelyn asked the question on microfinance and the challenge of potential over-indebtedness. And Evelyn, like the example I gave earlier, policy is about balancing different things. So in the case of lending, either to small businesses or to individual consumers, there are 2 points of view. Our legislation at the moment limits what can be done if you recklessly lend as a microfinance player or as a bank or as a retail store selling on credit. You could effectively be held liable for that, in that if the person can't pay, you stand to lose that money. But in addition to that, there are remedies available in the law, and we have, in fact, beefed up, Parliament has beefed up those remedies, and there are new provisions that will come into effect at some point. We're now working through the detail with industry. Now, if we are too permissive, if the system is too permissive, there's the danger of over-indebtedness. Every country faces this problem, particularly where there are large numbers of low-income persons. And the burden sits then with individuals who are lured with easy loans, with enormous repayment terms. If the legislation is too restrictive, then people who genuinely need the support of a loan during a difficult and unusual period would be deprived of it. So it's about finding the right balance. We looked at a number of different means to do this. The first was the legislation itself, the National Credit Act. It has a requirement that lenders, people who lend money, whether they are microfinance or big banks, by the way, there's in both cases there's always the challenge of over-indebtedness, but there's a requirement to act within the constraints of prudence, acting appropriately, not enabling consumers to be so over-indebted that they can never climb out of debt for the rest of their life. So there are two provisions in the legislation that can mitigate. So the presumption, Evelyn, is that you should not act and lend recklessly. The one provision gives the Minister of Trade, Industry and Competition the power to effectively designate that a certain category of agreements would be called public interest agreements. And that means the normal eligibility criteria don't apply. So you may be able to get a loan then, even though your debt levels are high. The risk with that is it has a greater prospect of being abused because it could be open-ended.
Mr. Patel, sorry for this disturbance. We have another press briefing at 17 hours. We are now left with how many minutes?
15.
15?
Yeah.
Yeah. And she has a meeting at 5. But you don't have any questions now. Yeah, you might as well leave, yes. Yeah. So I was just saying, if we can round up.
Okay.
Yeah.
So coming back then to this, there is a second provision in the law, Evelyn, which enables emergency loans for specified purposes to be given, and the National Credit Regulator has, in fact, taken steps last week to enable that. On your question of the repo rate, that's a function largely of the work of the Reserve Bank. On your question on taxation, we have a very active Minister of Finance, and he's spending time thinking through with colleagues in Cabinet how best we deal with this. And I'm sure as and when he announces the budget, the detail will be set out in more detail.
I thought you were saying he's spending time in Makubastu.
So I'm not going to respond to the.
Just ignore that one.
The witticism by the Minister of Justice, and as we greet our colleague who had to leave. Yeah. So I think that covers the issue. On the question that came up earlier on hot foods, on all of these issues, it's a matter of some degree of judgment that have to be placed in these things. There is no perfect science in it. It's trying to see how can we make sure that the aggregate level of things that happen don't contribute to a rapid spread of the virus. I think there was a question that we didn't hear from Finweek, so I think the caller got cut off.
There was, I don't know what the question on parks and beaches.
The question from Finweek was with regards to people being allowed to visit family. And basically the question is based on if some people are allowed to go to church for spiritual and psychological well-being, why can't other people who need that from their family go and visit their families for the same purpose?
Well, I think the way the regulations and the directions stand now is that we can visit our families in the neighborhood. The only problem is when we must go beyond the province where we live and the district and the metro where we live. For the purpose of visiting our families, if there is a need, yes, we can still get permit to go and visit our families if whatever need has arisen for us to visit them. Because we are not living in normal times. Now, that's the other issue that all of us should really take to heart. These are not normal times. These are COVID-19 times, where we need to take every precaution to save ourselves from infections, but also to ensure that we also don't become infectors ourselves. So I think what my colleagues have said, ultimately, we must all adapt to these times, ultimately, all of us. It cannot only be a government regulations and government directions that will guide our behavior around this terrible pandemic. You know, we know that so many thousands and thousands throughout the world have died because of this pandemic. But equally, we have got many people in our own country who have also died because of this pandemic. Therefore, the measures that we are taking, again, as the ministers have said, are meant to save lives. Ultimately, all these measures we are taking around movements, all these measures we are taking around the health protocols and hygiene protocols, all these measures are meant to save lives. They are not just a nuisance to our people, no. They also affect all of us because we have a responsibility to stay safe, as our slogan says, and protect South Africa. And all of us have that responsibility. That's why then these regulations and the directions. Minister Lamon?
Yeah, I just wanted to add that on this point that Minister Mthembu has been alluding to, one of the key considerations we're looking at is the fact that there are these hotspots which are already red, and Minister Dlamini said that this is where our economic activities are mostly happening. So as we deal with this issue of differentiated levels to alert level 2 and 1, we are grappling with the issue of how then do you minimize the risk of these hotspots transferring the disease to the non-hotspots in the various rural areas of our country. Hence, we have remained with some level of restriction with regards to movement to, at this stage, manage that issue of cross-pollination between the metros or these red hotspot areas into the other areas which are not hotspots. But as information and data becomes more available, it will also help us as we deal with the differentiated approach and we ease in the areas where it is not hotspots to allow for more easing of the restrictions. Thank you.
Thank you very much, colleagues. That basically brings us to the end of this media briefing. We want to assure South Africans that we will, as we approach whatever level, including level 3, we will keep on updating all of South Africa. What are the measures we are taking? What are the regulations we are putting in place? And what informs those regulations? But as colleagues will also know, as our media will also know, we have also, as ministers have said, consulted broadly, not only with labor or community organizations and business, but we have also consulted with political organizations that are represented in Parliament. We have consulted with our traditional leaders. We have consulted with our with our faith-based organizations, so that whatever direction we take as government is also informed by these consultations. So we are quite happy that as we proceed to level 3 on the 1st of June, next Monday, we have indeed been given the necessary green light by many stakeholders in our country to proceed to that level. But more important is that, government will not be able to police over 57 million people in our country. Ultimately, the responsibility to stay safe and the responsibility to protect our loved ones against this pandemic, the responsibility to protect our families, the responsibility to protect our communities rests on our shoulders. As Madiba said, it is up to us, as our president said, we must do whatever it takes to protect ourselves, to protect our families, and to protect our communities against this deadly disease. With these words, thank you very much. I know that it's now almost 5 o'clock. We have another briefing lined up by the JCPS cluster. See you now.
All right, as Minister in the Presidency said now, Jackson Mthembu, that there is a briefing that we are expecting at 5 p.m. and of course we will be broadcasting it for you live here on SA Today. Members of the National Command Council there, Nkosazana Dlamini Zuma, Ibrahim Patel and Ronald Lamula weighing in on some of the issues and the restrictions that will happen under level 3 of the lockdown.